Hello and welcome to Module 2 of the Continence Foundation Australia's series on consumer engagement. My name is Anja Christoffersen from Champion Health Agency, and it is my pleasure to be taking you through this training. So Module 2 is about enhancing your impacts. So before we begin, I'd like to do an acknowledgement of country. So the Continence Foundation of Australia acknowledges the traditional custodians of country throughout Australia and their continuing connection to land, sea, and community. We pay our respects to elders past, present, and emerging. And where I'm recording this training from today on the beautiful Sunshine Coast, I'm on the lands of the Cubby Cubby people. Today, we're going to be learning a bit more about the incontinence statistics and scope, the role of the foundation in advocacy, how lived experience can impact change, going to be going through a case study of my experience in incontinence advocacy with the foundation, look at some principles of engagement, why self-care is important, self-awareness in advocacy, preparing for consumer engagements, questions to ask when engaging, and evaluating diversity. When you finish this module, we hope that you'll be able to understand the key facts and figures on incontinence and the importance of advocacy. Understand how lived experience can create change across the system. Apply lived experience to create impact, and evaluate lived experience diversity and encourage inclusion. So, did you know that incontinence affects 1 in 4 adult Australians? That is over 5 million Australians, so many more than I had ever realized, especially growing up feeling like I was the only person who experienced incontinence. So urinary continence affects up to 10% of Australian men and up to 38% of Australian women. So you can see that's a lot more women than men. Actually, 80% of people with urinary incontinence are women. And 1 in 3 women who have ever had a baby wet themselves. So incontinence is predicted to impact 6.5 million Australians by 2030. That's an increase in 1.5 million people who will experience incontinence. So it seems like a pretty important topic for us to advocate for. So fecal incontinence affects 6% of Australian men and 10% of Australian women. So 62% of those with fecal incontinence are women. The foundation plays a really important role. The Continence Foundation of Australia, established in 1989, is a not-for-profit organisation and the national peak body for incontinence prevention, management, education, awareness, information, and advocacy. So, lived experience. This is where we fit in as consumers or carers. I'm both, actually. So lived experience, as you can see here in that center of that flower that I made, has a really important role in a number of different ways. And then you can see over on this side, the different ways that it can fit in to society and people, organizations, government and policy, or creating an evidence base or research. So going back over to the flower, how can lived experience create a change? So in strategy or systems. So when we think about the Continence Foundation, for example, they have strategies on how they will operate as a foundation. Lived experience has a really important role here in actually informing, what is important to the community and what is important to us in how we live our day-to-day life with incontinence. But lived experience is also really important in a system role and in strategy roles in a broader sense and how the health system actually operates and how the health department operates. If 6.5 million Australians are going to be impacted by incontinence by 2030, we're going to actually have to think about a lot of things. How do we get incontinence products out to people? Even if there's a natural disaster, how do we get incontinence products out to people? Things like that. It's actually taking a big systems view. Awareness and storytelling. So I have a really good story, and I'm sure you have a really good story. And it's that storytelling that can raise awareness and make people like me, when I was little, not feel alone anymore. Humanity and empathy. There's a lot of data out there on incontinence, or the Continence Foundation is definitely building that for us. but a number can only tell part of the story. And the role of lived experience is to actually build that humanity into it and that empathy into it, to put a human face and a story around that number, because it's actually about, that feeling, not just about the data. And that's what lived experience can bring. Research and design. So, what should be researched, how it's researched, how things are designed, from incontinence pads to incontinence products, to research on new ways of managing things. Lived experience is really important to not only inform what is researched, but how it's researched and what the outputs are. Activism and rights. This can be one that's a little bit scary to people. And I don't necessarily mean that you have to go out on the streets and protest and have your pitchforks up, but there are a lot of important things around rights. Do you deserve to have better rights at work, like so you can go to the bathroom more often without having to ask? Or do you think that kids deserve to go to the bathroom more when they're in school without having to ask? What sort of rights do you think are needed? And how can lived experience inform that? Because we can't expect people that don't live it every day to know these things. So lived experience being at the center of all these different ways that it can impact change then flows into that list that I showed you and discussed right at the beginning. So it can inform in society and people, how we think, how we operate, organizations like the Continence Foundation, government and policy, but also the evidence base and research. That we're not only looking at the evidence base of what's happening in a lab or what's happening in a hospital, but what the people in the community are experiencing and what they're saying. So that's a really high-level overview, and I hope it hasn't been too confusing, of how lived experience can truly impact change. So a little bit about my story. Like I've said, I thought that I was alone with incontinence. I mentioned in Module 1 that I was born with an anorectal malformation as part of a bigger disability called Vactral Association, and I had a reconstructive surgery at only 7 months old, and that meant that I had fecal incontinence for my entire life. There's nothing that could happen for it to be cured or managed better or treated, really. So when I was, 19, so in 2018, I decided that it was time for me to actually speak up about it because I wasn't alone and there were so many other people that experienced this. So I reached out to the Continence Foundation of Australia. I'd had a career in modelling. I was just about to launch my book, and I reached out and I said, I want to share my story. I think that this is really important. So I wrote, was interviewed for the Bridge magazine, and this was my story. I was finally a cover girl, and you can see my book is there as well. And from catwalk model to role model, and that was really special to me because for me, it was never about being a model on a catwalk, but being a role model to other people. And so you can see there that the Bridge magazine is one of the many ways that the Continence Foundation is able to share our stories. So from there, I actually had media training. So in that little video that you can see, that snippet, that was actually taken when the Continence Foundation provided me with some media training on how I was better able to speak to camera and be interviewed about key messages from the foundation. So I did that media training, and I also had an interview with Mamma Mia and Nine Honey, and from there it just flowed. I had interviews on TV about my incontinence, and you can see some of the titles weren't so fantastic, labeling it as an embarrassing condition, but it was really important to me to be able to have this message out there. And it was another way that the Continence Foundation could help to get their message out there to a broader audience. And then this was the 30th anniversary of the foundation in 2019. I had the opportunity to speak at their national conference. So this was in their welcoming or opening presentation. I was able to share my story of incontinence, but also share what the Continence Foundation meant to me in all the ways that they had helped me and supported me over the last few years. So that was very special to me. And I was able to feel part of a community at that conference, surrounded by so many other people who support people with incontinence like me. So all those three things together were different ways that I was able to contribute to the foundation. And I hope that inspires you to think about different ways that you could contribute to the foundation. In between all of that, I was able to be on their Continence Advisory Committee and their Policy Advisory Committee, so also help in other ways too. So this brings me to the principles of engagement. We need to have a mutual respect and value for each other at the foundation, between the foundation staff, but also between consumers. We need to encourage diversity in the different ways that this looks like in age, in cultural background, in ability, in gender, diversity and sexuality in every single way. We need to enable through information, leadership, partnership, and collaboration, capacity building, integrity, and accountability. We need to be fair and transparent, coming from both sides. We need to follow through on our commitments, and evidence-based practice. This brings me to self-care. And self-care is something that's so important in our advocacy because what we're doing for work is something that relates to something very personal. And incontinence is something that's very personal, at least to me, and I'm sure to you too. So there are many ways that we can debrief. So we can debrief through the foundation. They have fantastic support staff. The ones that have linked you into your engagement are the people that you can go to speak to if you need to talk about anything. But also make sure that you have your own support system, whether that be other consumers that you've done engagements with, whether that be your friends or your family. Make sure that there are people that you feel that you can trust and you can talk to about different things. And don't feel afraid that you need to talk to someone about this sort of stuff, because you are talking about things that can be triggering, and that it's taking a part of yourself that's your lived experience, and it's using it to create change for the better. And it is something that's important work, and you need to give yourself the credit that you deserve with it. Also, make sure that you have mental health support if you need it, and again, don't be afraid to reach out. There are lots of resources online, but the Continence Foundation can also provide you those resources if you cannot find them. Know that you can say no. That is not a reflection of you, but make sure that you do say no if you don't have capacity or if you don't feel up to anything. But also think about what fills your cup. And I've always found this to be a bit of a funny saying, but what brings you joy? What makes you feel energized? And whatever the answer is to that question, try and do more of it. And try and do more of that than what empties your cup or what drains you. It's also important to have self-awareness and advocacy, and that is not the assumption that you wouldn't either. So other people may have different experiences, thoughts, and perspectives to you, and that's okay. It doesn't mean that you're wrong or they're right or you're both wrong. You both quite certainly could be right, because lived experience is still your experience, is still true. You're still right. You should still be validated. And it can be incredibly invalidating when you're having someone with a lived experience of something similar as you saying something different. So I understand that it can be incredibly triggering, but it's important that we create space for everybody to share their thoughts, share their experiences, share their perspectives, and also feel heard. But also understand how your experiences may impact others, and also the use of language that you use, making sure that you're aware of any discriminatory language that you're using and trying not to use that, because it can be really triggering to people. Also, the use of language around, incontinence is embarrassing, incontinence is an issue, incontinence is a challenge. While a lot of these things can be true, trying to take a strength-based approach, because for someone else, they might have moved forward or they might still be back in the pain of incontinence is really hard. So trying to take awareness, understand what other people are at in the room, understand what their experiences are, and trying to understand what language you should use to make sure that everybody does feel heard and understood, but you're also able to communicate your perspective. Advocacy can be uncomfortable, and consumer engagement can be uncomfortable, but it's up to you to understand why and to look inside yourself and reflect and take time. And I think this is a beautiful picture of reflection. If only we could all go to a place like this and sit down and be peaceful and do it. But try and take some time to reflect and understand that if you feel uncomfortable, why do you feel uncomfortable? And is there something that you can do to address it? So to prepare for consumer engagements, ask for what you need. So do you need pre-reading? Do you have any accessibility requirements? Do you need more information? If you've been given pre-reading materials, make sure that you read them. If you can't, try and communicate that beforehand, because you don't want to come into a meeting and everybody else has read the document and you haven't read it and you don't know what's going on. Try to know how you'll be contributing, but also reflect on how your experience relates. And think of some relevant examples. So some questions to ask when engaging. So number one, who is this targeting? So is this targeting the community? Is this targeting women with incontinence? Is it a niche? Is it a broader target audience? Is it targeting health professionals that help people with incontinence? Are those health professionals working in hospital? Are they working in clinics? Try and get as much information as you can, because that can actually influence what you're developing or designing or whatever you're doing. Ask if or when and how do consumers receive this, if it's information or a policy, because that can be very relevant. How does what we are doing impact consumers? Very important question. And how will lived experience be incorporated both into the decision making and into the end product? What are the main benefits to consumers? What have other consumers said? So this is a trick question I've found, because in some consumer engagements I've done, not with the Continence Foundation, but they've gone and asked some consumers, they've said something, and then they've gone to different consumers, they've said something else, and they can ask lots of different consumers until they get the answer that maybe they want, or maybe they're looking for different perspectives. And it's really important for you to understand what other people have said so you can assess the different perspectives. You might have the same perspective, you might have a different one, but it's important for you to know what other people are saying in the broader community, consumer community. But then who does this resource, information, educational policy not work for? So for example, this policy might be really good for young women, but it would be really bad for working moms because they just don't have the time to go to the service because they are at home looking after the kids and really, really busy, or they're trying to juggle work and children, whatever. That's an example, I'm not sure. So some questions to ask yourself. What experiences have I had and heard that relate to this engagement? What consumers does this benefit and who will fall through the cracks? Does the language both reach people where they are at and set the tone for where we're wanting to go? So, evaluating diversity. This is something that is very important. So, what consumer perspectives are not included? So if you are in a group, have a look around the table, or have a look around the online focus group and see who is not there, and how can you try and involve them. So consider perspectives that may have faced inequities and if they're represented. So for example, people that are not from an English speaking background, have they been able to give their perspective? Certain groups with different disabilities that may find it hard to contribute. So people that might be deaf, for example, that might not have been able to contribute in the way that feedback has been required. Consider strategies to engage communities that are not heard from, but also acknowledge the strengths while you acknowledge the gaps. So these are really important things to consider, because while you're there representing your perspective, It's not necessarily your role to try and represent every perspective, but it can be part of your role to acknowledge what perspectives are not there. And considering what perspectives are not there, they might not just be the perspectives that aren't in the room, there could be the perspectives that aren't included in the data sample that you're looking at as well. So, yes, it's time to ask the important questions. So thank you so much for joining me for Module 2. It has been a bit of a long one, but I appreciate you sticking around and letting me get a little bit philosophical at times. It's always a pleasure to be here with you. So some resources, some help and tips for being an effective advocate. It is written for mental health advocates, but it is such good information for all health advocates. Tips on getting started as a consumer rep from Health Consumers New South Wales, and guidelines for consumer representatives. And it's a great resource if you're elected to a committee. So thanks so much for joining me, and I look forward to seeing you again soon for Module 3.